The first time we are getting an inside look at the operation to slow the spread of measles in Gaines County. Senior officials from the CDC visited Seminole today to help support the team on the ground and learn from them.
KCBD News Channel 11's Brittany Crittenton joins us there in Seminole with the mission behind the visit. Brittany?
Karen and Abner, the CDC says it's really the state and the local health departments that are taking the charge on controlling this measles outbreak, and they're just here to support. But part of that is actually physically being here and seeing and hearing about real experiences on the ground.
And we do everything with prep with the goggles and everything. We're extremely safe.
Health officials in Seminole are showing federal leaders how they transformed the Emergency Operations Center into a fully functional measles vaccine clinic and testing site.
Seeing like the dedication and also just seeing, how you take this and make it into a clinic that works is so remarkable, and just again shows the importance of strong public health infrastructure and dedicated people who are really excited to help the community, because that's what this is about.
Dr. Dimitri Daskalakis is the director of the National Center for Immunization and Respiratory Diseases at the CDC. He says it's deployed several teams back and forth to Texas to help stop the spread of measles.
We've been working with the CDC since very early on in the outbreak, and we are very excited that they're here today. We've been in constant communication with them the entire time, and they've been very, very helpful to us.
When it comes to slowing down case numbers, Dr. Daskalakis says there are several ways to do that, like getting the vaccine, staying away from people if you're sick, and getting care quickly to prevent severe complications.
I think it's also important to make sure that we round out that toolkit and give people options if they cannot or will not get vaccine for one reason or another, which is why we're actually working on another product that should be coming soon that really sort of addresses what happens when you get measles rather than just focusing on the prevention side. With that said, prevention is the way.
Melanie Lee oversees the clinic as the director of nurses for Region 1 with the State Health Department. She told Dr. Daskalakis about some of the challenges they're facing on the ground.
But the thing is that everybody wasn't exposed usually simultaneously, so you could see different stages of potential measles inside of one vehicle. And so our job is to make sure that we take care of anybody, just whether they are vaccinated, unvaccinated, symptomatic, asymptomatic. And generally that's where I say that ends up with a phone call to him to talk about, hey, what are we going to do to take care of this specific situation or this family?
Dr. Daskalakis says it's important to assume measles will be here to stay for a while.
I think that there's, good evidence that maybe we're seeing some decrease or some plateauing of cases here, but measles is very contagious and people like to move around places, and so having that sort of patrol and guard out is really important so we can make sure that we're able to respond nimbly.
Dr. Daskalakis says it was their job today to be a sponge and to really absorb all of this information so that they can take it back to headquarters so it doesn't just sit here, and they can spread that information to other regions. Karen and Abner.
Thank you, Brittany.